Today, I'm talking about lower back pain and the most common causes that I see in clinical practice every day. So if you have lower back pain and you want to know what's causing yours, then stay tuned because I'm talking about that right now. There are so many different causes of lower back pain that I cannot go through them all today. But what I will say is that there are common causes of lower back pain. There are causes that we need to be aware of that are possible. And then there are the rarer causes of lower back pain that I'm not going to touch on today. The most common things that I see in clinical practice are muscles, tendons, ligaments, nerves, discs, and the bony structures of the vertebra, such as the joints themselves. Most of the time, this is what someone would present with, one of these possibilities. But we also need to be aware of other things that can happen that affect certain age groups. For example, if you're in your 20s and 30s, there's a high possibility that low back pain could be coming from a disc. As you get older, discs tend to become thinner and more dehydrated. So unless you've had history of a disc problem in the past, as you get into your 40s, 50s and older, it's less likely to be disc related. If you're in your 40s, 50s, 60s, there's a possibility as a male that we could have some kind of prostate issue going on. As a female of any age, you could be thinking about gynecological issues. Then as you get into your elderly years, 70s, 80s, there's an increased chance of abdominal aortic aneurysms, and that could potentially cause a very serious medical problem. And then of course there are the rarer problems with your lower back, which I'm not going to touch on now. But what I will say is that if you do have lower back pain and you haven't had it diagnosed, then go and see a doctor just to make sure there's nothing untoward going on. So what I'm going to do right now is break down lower back pain in terms of what you can see with the anatomy. So this is a fairly complete skeleton here. These are the ribs. You're looking at the back side of someone here. These are the bumpy bits in the spine that you can feel if you run your fingers down your spine. And then you've got the two pelvic bones on the outside here. Now, quite often when someone comes in with acute lower back pain, they will have very non-specific pain, as in they won't be able to tell you exactly where that pain is. So generally speaking, that pain will go all the way across from both sides. So all in the lower back, coming up to around the region of the 12th rib here. They won't be able to tell you where that pain is exactly, but as that pain starts to wear off and the pain becomes less acute and more into the chronic pain, they will generally feel pain becoming more isolated into one particular area. There's quite a lot going on structurally in the lower back with the spine, the discs, nerves. So I'm just going to show you on a spine what that might look like. Okay, so here is a model of a spine. Again, this is looking at it from the back. On this model though, you can see much more easily all of the different segments of the vertebra. So all of these white bits are the bony segments of the spine. These are the bumpy bits that you can feel as you run your fingers down your spine. These are called spinous processes. The yellow things coming out here are the nerves. If you look closely where the bones overlap, these are joints. And quite often these can become compressed. And if they become compressed, they can become irritated. These are called facet joints. And as you can see, they're quite close to the nerves. So any inflammation or compression in these small joints can cause inflammation that will irritate the nerves. And all of the muscles that these nerves are supplying will likely become spasmed. If I flip it around, you can see this red bulgy bit here. This is loosely representing a disc bulge or a disc prolapse. So these lines that you can see here, these are the intervertebral discs. So these discs allow compression and allow movement between each vertebral segment. If one of these discs becomes prolapsed or bulges out, as you can see, that is also very close to the nerves. So when a disc bulges out, there's usually a release of chemicals which causes inflammation, and that will sensitize the nerves, again causing muscle spasm. Connecting all of the vertebrae together are ligaments. These are what hold the bones to bones. These are less likely to become damaged in normal day-to-day activities. But if you have something like a road traffic accident where someone hits you, from behind in your car, these ligaments can quite easily become overstretched and become sprained, and they can also cause pain. Now, if we move more superficially, I will show you what it looks like with the muscles attached to the lower back. So now I've got a model of the lower back. So this is purely the lower back, so the 5 segments of your lumbar spine. This is the same view I just showed you from the back, but this time we've added on a load of muscles. So these muscles on this side are the deeper muscles. As you can see, there's quite a lot of muscles. They connect all of the vertebrae together. And then on this side, you've got the more superficial muscles. So in relation to a back, these muscles that you can see here are the kind of more superficial ones that would generally run down the spine, either side of these spinous processes. Now, most of the time when people come in with lower back pain, these muscles are in spasm, and this is what causes people to have that inability to move, that stiffness, and that pain when they start to move. So as I said earlier, the nerves can become affected, which then affects the muscles surrounding them. So these nerves branch off and they innervate the muscles around, so into the lower back, the hips, down the legs. So any of these nerves that become affected will likely cause spasm within the muscles. So any structure that is irritated or affected in the lower back, such as ligaments, tendons, discs, will usually cause some degree of inflammation. And it's that inflammation that causes the local spasm, because the nerves are what get affected. So when someone comes in with lower back pain, the first thing we need to try and do is to get that inflammation down and then decrease some of this spasm, because without decreasing that spasm, people aren't going to be able to move, and every time they do move, they're going to find it difficult and they're going to find it painful. Now, when it comes down to it, one of the most common reasons for people to develop any of this pain, whether it's a ligament, a tendon, muscle, disc, most of the time that has arrived from people being too weak. Now, maybe this is relevant to you as well, where you may have been sitting in a chair for too long. So for example, you might be an office worker, or you might be, due to the lockdown, you might be sitting on your sofa for too long. So these muscles have become weaker. When these muscles become weaker, any activities that you do will either make you feel like you've got pain because the muscles are now unable to cope with the physical demands, or the lack of strength in these muscles has led to a lack of stability within the spine. And that is what then has put pressure on the discs, because the muscles aren't able to hold your spine in place. So the discs have taken more strain through them, and those discs have become weaker, or the same with the ligaments around the spine. So generally speaking, most people have become weak in their lower back. Now, not only that, but that lack of movement has also led to an increase in tightness in these muscles. Now, one of the common places that people get pain is around where the pelvic bone meets the sacrum. So where these erector spinae muscles come down and attach, this is one of the most common places that people get pain. And this is because these muscles have either had too much repetition through them. So for example, you've moved house, you've done gardening, and the muscles are just not strong enough to cope with that new increase in demand. And then the muscles have got irritated, that irritation has caused spasm, and then that spasm spreads all across the lower back. So just to summarize, the most likely explanation for someone having acute or chronic lower back pain is that the muscles in the lower back are far too weak. If it's acute, then the weakness in the lower back is what's predisposed someone to develop it from a repetitive movement or lifting something that's too heavy. Or if it's chronic lower back pain, then these muscles have remained weak because you feel pain, you haven't been strengthening your lower back. And that's put you in this constant cycle of pain and weakness, pain and weakness. So you're constantly getting weaker, but to break that cycle, you need to start strengthening those muscles in your lower back. Now, when it comes to how lower back pain presents, there's either acute lower back pain or chronic lower back pain. Acute is when someone has done something and the pain is very intense and very recent. So it could be something that you've done today, yesterday, or within the last week or week and a half. Generally speaking, you will be in a lot of pain. There'll be a lot of stiffness and there'll be a lot of pain on all movements. So generally, sitting still will be relatively painless. You might feel some sense of spasm or tightness or aching, but it's when you start to move, that's when the pain will kick in, and it will usually stop you from easily moving from one position to another, such as standing up from a chair. Usually you might get about halfway and then get stuck, and then you need some kind of assistance to get you all the way up. Or it could be something like turning over in bed. Acute pain will usually last for about a week to a week and a half. After that, it starts to become a little bit more subacute and moves towards chronic pain. Now, chronic pain is when you've had the pain for many weeks, months, or even years. Generally speaking, the pain will be less intense. Whereas acute, you might be looking at a 7, 8, 9 out of 10. Chronic pain tends to be around 3, 4, 5 out of 10, and you won't be able to pinpoint where the pain is. But with chronic pain, that pain becomes more focused and you can pinpoint exactly where you feel the pain. So in order to improve your lower back pain, you need to distinguish what phase you are in. Are you acute? So is your pain a 6, 7, 8, or 9 out of 10? Are you having problems moving? Are you having problems standing up? If that's the case, you're in phase 1. Now, if you've seen any of my previous videos, you probably would have heard me talk about different phases of recovery. This is something that I have developed over the years. Phase 1 is about getting you out of pain. Phase 2 is about re-establishing your movement, your flexibility and mobility. Then phase 3 is about strengthening that region that's been injured. So if you are in acute pain, then you are probably in phase 1. You need to get that pain down. Phase 1 is all about gentle movements, trying to get the muscles working, trying to get that inflammation down. Things like gentle massage, ice packs can really be beneficial here. Phase 2 is once the pain has come down from a 7 or more, and it's now into like a 5, 4, or even a 3. So that's the point when you start to stretch. So this phase is all about just stretching. Obviously you're going to keep moving as well, but stretching is the main focus. Once you feel that your flexibility is now getting back to normal or even better than normal, then we go into phase 3. And phase 3 is all about re-strengthening the muscles. And this phase is all about using body weight, using resistance work to try and work those muscles to make them stronger. So now that you understand all about your lower back pain, I want you to leave me a comment and let me know how this video has helped you understand about your lower back pain. Today we are talking about slip discs. Now you may have heard the term slip disc. It's not actually a technical term, but a disc is a soft structure that goes in between the vertebra. And the purpose of a disc is to act as a cushion between the vertebrae. It allows movement and it allows the absorbance of shock. So when you're moving around, those discs can compress and they act as a shock absorber. Now, discs are one of the more common things that go wrong within the spine. There's two main areas that a disc will cause a problem: up into the neck and in the lower back. Of course, it is possible that discs can become a problem anywhere in the spine, but the two most common areas are in the lower back and in the neck. But for the purposes of today's video, we're only going to be discussing the discs in the lower back. But the principles will still apply into the neck as well. So if you do have a neck related disc problem, don't worry, this will still be relevant to you and it will still give you some information that may help you. So the first thing we need to really discuss is exactly what is a disc. Well, as I just already mentioned, the discs go in between the vertebrae and they act as a cushion. They act as a shock absorber. They allow movement between the vertebrae. Discs are made up of two main kind of structures. The first is a gel-like substance that goes in the middle here. This is called the nucleus, and then the disc is made up of various different rings that go around it. This is called the annulus. Now I want you to think of a disc a bit like an onion. Strangely enough, I have an onion here. So with an onion, the onion is made up of rings, circumferential rings. Now each of these rings has different directions of fibers. So as you can see on the skin of the onion, there's lots of lines that go along vertically. In a disc, each ring is made up of these fibrous layers. In the middle is where you'd have the nucleus. And I want you to think of the nucleus a bit like a gel-like substance, a bit like toothpaste. So you've got these rings, and in the middle you've got this gel-like substance, and that's called the nucleus. So when you move, when you're moving around and the spine is bending in all different directions, that nucleus is being pushed in all sorts of different directions, and it depends on where the pressure is within the disc. Now you may have heard the term slip disc. Now a disc doesn't slip out. It doesn't go from where it is to just kind of pop out in one direction or the other. It's not sort of just positioned in there and it's loose. Actually, it's sort of cemented to either side of these vertebrae. So if you look at these two here, it was kind of glued on either side. So it's not going to actually go anywhere. But what can happen is this central substance can end up becoming sort of pushed out one side or the other. Now the nucleus tends to come out towards the back. So this is the back of the spine, this is the front. So the gel-like substance, the nucleus, will tend to come out mainly towards the back, towards the sides, and occasionally it can come centrally through the back as well. The reason why a disc won't sort of bulge or prolapse out the front is because at the front of the spine there's a really thick ligamentous layer. So that provides a lot of structure and support, so the disc cannot really bulge out of the front of the disc. So as I've just mentioned, that was the structure of a normal disc. Now what can happen over years is these layers in the disc become thinner or they become slightly torn. And what can happen is the central part of the disc can start to sort of creep out towards the back and towards the side. So here, this is called a bulging disc. So this central substance has not quite come out, so it hasn't left the disc, but it's sort of pushing out towards one side. So this is known as a bulging disc. As that progressively gets worse, so as those layers of the disc become gradually weaker and more torn, then the disc can find its way out, and that's known as a disc prolapse. So this is how it would look if it was a disc prolapse. As you can see, the central substance has now pushed its way out, and so as it's pushed its way out, what happens is it can compress on the nerves that would normally be coming out of here as well. So if I show you on this one, here you can see where the central substance, the nucleus, has pushed out of the disc and is now compressing this nerve. So when this happens, you can get compression of the nerve and it can cause a lot of pain. So depending on how much this substance has been pushed out, even at this stage, at the bulging stage, this can cause pain. So if this bulge is starting to push or starting to compress some of the nerves that come out here, then that can cause some neurological symptoms such as pins and needles, pain, weakness. But generally speaking, if it's not that severe, it won't often cause that much of a problem. The more it bulges out and the more severe it becomes, the more problem you would expect, assuming that it is compressing one of the nerves. So the symptoms of a disc problem, generally speaking, would be pain, numbness, pins and needles, or weakness. Now, most people sort of in their 20s and above could potentially have a disc related problem. I, for all I know, could have a disc bulge or a disc prolapse. People can have disc problems without having pain or without having symptoms. And vice versa, people can have problems, nerve pain, pins, needles, weakness, without even having a disc problem. So just because you may have been diagnosed with a disc bulge or a disc herniation doesn't necessarily mean that that is what's causing your pain. So sometimes what happens is people get diagnosed with an MRI and it shows a disc bulge and they think that that is the reason for their pain, but it's not always. So I had a young lady come to see me quite a while back now, and she had back pain. It was fairly non-specific, and there was a vague sense of sort of pain down the back of the thigh, but it was nothing that serious or nothing particularly excruciating. She was still walking around just fine. Eventually, the pain seemed to just progressively get a bit worse, so we decided to send her for an MRI. And actually, the MRI came back with a very severely prolapsed disc, to the point where it was almost sort of cutting off some of her spinal cord. So actually, this was a medical emergency, and we sent her to hospital and she was operated on within a day or two. But the severity of the disc prolapse that she had was not correlated to the pain. And without that MRI, if she'd have gone to the hospital with just the symptoms that she had, she would probably have been sent away just with painkillers. But because she took the results of her MRI and it showed how severe it was, they actually took it seriously and admitted her in. So what can cause a slip disc? Well, poor mechanics, generally speaking, will wear a disc thinner. As we get sort of into our late 20s, early 30s, that tends to be the most frequent time a disc would go wrong. But the reason is because discs generally are quite thick and plump and hydrated. So in our younger years, there's plenty of cushioning, plenty of movement for these discs. So they're more likely to go wrong when they're younger. And as we get older, the discs tend to become more dehydrated and thinner. So unless you've already had a disc problem in your earlier years, then when you're sort of in your 50s, 60s, you're less likely to get a disc prolapse or bulge or slip disc if you haven't already had one. So over time, these layers of the disc, so if you go back to thinking about the onion, these layers tend to become a bit weaker in a certain place. And as pressure is put on the disc and this central substance is being pushed in one direction, that will tend to cause more pressure on those tiny little cracks in those layers, and eventually it will be pushed out the back, and that's when it becomes a disc prolapse. So poor postures, so sitting a long time, not being fit, not being healthy, being overweight, lifting heavy objects with poor lifting technique, and even vibrations. So people who sit in lorries or heavy industrial machinery that vibrates will often weaken a disc. So lorry drivers tend to have quite a lot of disc problems as well. So I want you to think of a disc also a bit like a donut, a jam donut. So you've got the jam in the center, and then the outside, the sort of pastry, the bread part is the fibers. So here I actually have a jam donut. Well, it's actually a custard donut, but here I have a donut. And what I want you to imagine is that this is the disc. My hands are the vertebra, and this way would be the front and this way would be the back. So as we put pressure on a disc, if it's fairly central, you don't get much of a bulge of the jam or the custard in the middle. But as we bend forwards, so as the vertebrae start to sort of wedge, so the front goes down, so it's compression at the front, and then the back becomes more open, that puts more of a pressure of the central part of the disc to push it backwards. So as I wedge my hands, you can see it kind of bulge out. And that's very similar to what happens with a disc. The most common movement that causes a disc to bulge is a flexion type movement, or flexion and twisting. So whenever we lift something and we're lifting with bad posture, what's happening is we're pushing that nucleus of the disc more towards the back. So if we have a weakening of the fibers, at some point, something is going to cause that last fiber to just go. And that's when the disc will sort of push out or bulge out and cause you pain. So a disc does a slip disc or bulging disc, herniated disc, prolapse disc, it doesn't happen overnight. It happens over time. Now, when it comes to the diagnosis of a disc, quite often when someone comes in with pain, we can get an idea that maybe there is some neurological involvement. Maybe based on their presentation, we might suspect a disc, and there are certain tests that we can do, such as coughing, sneezing. Is there pain when you bear down to go to the toilet? If you bend forwards, does that cause you pain? So certain things we can do to kind of enhance our suspicions of a disc problem, but we will never be able to fully diagnose that there is a disc present without the use of an MRI. So an MRI is kind of the conclusive way to determine if there is a disc bulge or disc prolapse and what severity it is. And on the screen just here, I'm going to put some images of some disc bulges, disc prolapses. These are not my patients, these are just images that I found on a stock image site, but they're quite good images and they do show you what it looks like on an MRI and how a disc bulge or a disc prolapse might appear. So just to recap briefly, a disc bulge or a disc prolapse, if it's pressing on a nerve, that can cause pain, that can cause numbness or pins and needles. If it's quite severe, it can end up causing weakness. Now, if there's a disc bulge or disc prolapse in the lower back, what you might expect is sciatic type symptoms, so pain in the buttocks, down the back of the leg, maybe even as far as the foot or the toes. If the disc prolapse gets significantly worse and ends up severely compressing a nerve, what you could end up with is something called saddle anesthesia, and that's numbness on the inside of your thighs. And then even worse, you could get something called cauda equina, where a disc is basically compressing or obstructing the lower part of the spinal cord, and then that causes you to have an inability to pass water, so you can't urinate, and sometimes it might cause constipation as well. If it does get to the point where it is an inability to pass water, that is a medical emergency. So if someone came in to see me and they said they haven't been able to urinate, then it's straight on the phone to the ambulance and get them to hospital, because what happens is that patient can't feel, they don't have any control of their bladder. And if it keeps filling, then eventually what can happen is it can burst. So it's pretty serious, but generally speaking, I've never had that actually happen to me in clinic, so it doesn't happen that frequently, but I do know of people that has happened too. If for the most part the discs are compressing a nerve and it's not treated, but it's not so severe that it's cauda equina or the saddle anesthesia, it's just nerve pain. If it's not treated, then what can happen is the nerves can end up being permanently in a state of damage or weakness or pain. So it's definitely worth doing stuff about it, trying to get the pain down, trying to get that bulge reversed slightly, and get treatment as well. Now, when it comes to the treatment of disc related problems, disc bulges, disc prolapses, we can quite often start with just conservative approach. Now, as you might remember earlier with the donut, as you compress, you're more likely to get the disc bulge out the back, especially if you're flexing as well. So traction is a very useful way to cause a pulling of the disc, and what can sometimes happen is that can suck the nucleus back in towards the disc. So it helps to sort of re-establish some of that hydration, that thickness in the disc. So simply hanging from a bar is very useful. Or if you have chairs at home with arms, what you can do is just lift yourself up by the arms and let yourself just relax your bum and hips and pelvis down towards the bottom of the chair. And that causes a nice traction through the spine as well. We can also try physio exercises or movement-based exercises. Generally speaking, I wouldn't do anything with weights at this stage, but simple things like a Mackenzie press up where you're on your front and you push yourself back so you get an arch, so you're sort of arching yourself backwards. That can also help to sort of push that disc back in. And again, just other simple things like cat and cow from yoga, where you're getting movement through the spine, but because you're in a fairly neutral position, you're not causing too much pressure through the disc, so you're less likely to get any worsening of your symptoms. Because when you have a disc bulge or disc prolapse or disc related problem, you're likely to get a lot of spasm, a lot of pain. So movement is really going to help you to relieve some of that pain, or just get some of those muscles working and softening and relaxing a little bit more, because the last thing you want to do is stay still and not move. You need to move, you need to get those muscles working. So gentle movements, gentle exercises like cat and cow from yoga. Now, if with conservative treatment or exercises, the disc doesn't get better, the next step would probably be to go and see a doctor or surgeon. Depending on how serious the disc bulge is, it may require surgery. Now, in all of my years of being an osteopath, most disc-related problems I've seen have got better on their own. There's only 2 or 3 patients that I can recall out of 10 years of practice who have ended up having to have surgery. One was someone in their neck, and a couple were in their lower back. But after surgery, the outcome was pretty good. So although surgery, generally speaking, is something you want to avoid and only use as a last resort, it is actually a fairly common surgical procedure. What they can do is just snip off the bulging part of the disc. They can just trim the disc so it takes the pressure off the nerve. In extreme cases, what they may do is remove the disc completely. Sometimes they fuse the vertebra, and if you're lucky, sometimes they might put in a prosthetic disc. I'm not that clued up on the surgeries, so that's just what I've come to understand. But if you do go down that route, it's definitely worth consulting with your surgeon and asking what your options are. The outlook of a disc problem is actually generally pretty good. Now, it may be that you are in pain for a period of weeks or months, but the more you are doing, the better the chances of that pain getting better. Of course, when there is a disc bulge, there's going to be a lot of inflammation. So anti-inflammatories can also be used, but that's something to discuss with your doctor or pharmacist. But generally, the patients who I've seen with disc problems, most of them have got better and have got out of pain, and many of them have returned to normal daily activities, and some of them are even back in the gym training as they would if they didn't have a disc problem. So if you do have a disc problem, don't worry too much. Go and get it seen to, get it MRI'd, figure out how bad it is, start doing your exercises, start doing some traction, some gentle movements like cat and cow, and give it a bit of time. If it doesn't get better, then maybe consider the surgical route. But generally speaking, you can expect your disc problem to get better. Now, can a disc bulge or disc prolapse, disc herniation, slip disc be prevented? Well, there's no particular evidence to suggest that we can prevent it. If it's going to happen, it's going to happen. But we can certainly do things to minimize the risk of disc problems. So the first thing is just staying fit and healthy, making sure you're well hydrated, so that keeps the discs nice and hydrated. If you're lifting things, make sure you're lifting with a straight back and you're not bending forwards. If you're overweight, it's definitely worth trying to lose some weight, because the more we are overweight, the more compressive forces we have going through the discs. And also, it's just worth noting certain postures will aggravate discs. So on the screen right now, I'm going to put an image, and it just shows you the different postures that we can put ourselves in and how much pressure each of those postures will put through the discs. So when we're lying down, that's the lowest pressure within the discs. Then as we stand up, that's kind of the neutral, normal disc pressure. And then as we start to bend, the pressure goes up. As we sit, the pressure gets even higher. And then the worst thing, as you can see on the image, is if you are sitting and trying to lift something heavy, especially if you're bending forwards and twisting at the same time. So just have a look at these postures. When you're moving throughout the day, just be aware of what posture you're in. Keep yourself moving, and don't sit for too long in any one position. So that's a quick overview of disc pathologies. We've gone from slip disc, which is the layman's term for a disc bulge or disc prolapse. A disc prolapse and a disc herniation are pretty much the same thing. They're interchangeable. And in summary, discs are a very problematic structure for many people. It tends to happen more in your 20s and 30s, but if you've had it in your 20s and 30s, there's no reason why you can't have it again as you're older. If you haven't had a disc problem and you're older, then you're less likely to have a disc related problem as you get older. And if you do have a disc problem and you are suffering with any pain or nerve-related problems, don't worry, the chances are it will get better, but you have to just make sure you're doing the right things, avoiding things that are going to make it worse, and go and see someone, get it treated. If you are in acute pain at the moment, then this video is going to show you 4 simple things that you can do to help yourself get out of pain and get yourself back to your normal daily routine again. So the first thing we need to try and think about is what is first of all going on? Well, at the moment, if you are in acute lower back pain, then there's going to be a lot of inflammation, there's going to be spasm, and there's going to be certainly a lot of pain. So the first thing we need to do is try and get that pain and inflammation down. Now, every time you move, it's going to be incredibly painful. So the first thing you need to try and do is just get yourself into a pain-free position. So just sit or lie, whatever you can, just to help give your body a few minutes of rest from the pain. So find yourself a pain-free position, first of all. The next thing you can try is some anti-inflammatories. Now, it's always worth speaking to your doctor or your pharmacist who can prescribe you the right medication, but anti-inflammatories are going to help to bring some of that inflammation down and going to help to reduce some of that pain. Now, a lot of the time, my patients don't like to take medications, which is fine, it's understandable, but if you are going to take some, what I would suggest is to take the maximum allowed dosage in a shorter amount of time. So for example, take whatever you are physically allowed to take in day 1 and day 2, rather than trying to spread it all out throughout a week. What this is going to do is just hit the inflammation and try and reduce the inflammation as quickly as possible, therefore reducing pain. Now, if you are spreading out the dosages throughout the days or weeks, then what's probably going to happen is you're still going to be in pain, you're still not going to move, and actually you're going to be in pain probably for longer. So inflammation is a very important component of the healing process. But what can sometimes happen is the inflammation can stay for too long and it can end up leading to chronic pain. So what we need to try and do is just get the inflammation down long enough to get you moving again. So speak to your pharmacist, speak to your doctor, discuss with them the most appropriate dosage, and then stick to those guidelines. The third thing is to then start moving. So once you've given yourself a little bit of time away from the pain through the pain-free position, then you've reduced some of the inflammation through anti-inflammatories. The next thing is to start moving again. Now, this might sound counterintuitive to step 1, which is the pain-free position, but if you stay in any position for too long, you're going to continue having pain. It's not going to help you get rid of your pain. So you have to start moving. So the first thing I would suggest is to just do some gentle walking around. Just, if you can get up and walk around, then that's great. If you can't, then we'll go on to the next one. The next one is just cat and cow. So what you're going to do is find a bed, or you're going to be on the floor. Just try doing some gentle cat and cow. So don't try and push the range of movement. Start in the minimum amount of movement you can do. So what you're trying to do here is tuck your tailbone under and push your bum out. So you're doing 2 different movements and getting movement through the spine. Now, what this is going to do is get the muscles working. As the muscles working, initially, maybe you will start to feel pain. Hopefully, though, you can find some movement without being in pain. What this is going to do is get the muscles pumping and get blood moving through the muscles and help to push away some of that inflammation. So cat and cow gives your spine flexion and extension. So it's very one plane. The next thing you can do is what I would call thread the needle. And what this is doing is now adding in some rotation. And I'll show this again on the screen right now. So thread the needle, you're taking one arm through between the hand and the leg. And from there, you're coming back up and repeating. So you could do this multiple times on one side and then go onto the other side as well. So thread the needle is adding in rotation to this movement. And again, start off with a minimum amount of movement first. And as you find that you start to ease up or start to loosen up, then you can start adding in a bit more movement. Then from there, in the same position, you can start doing what I would call side bends. So the side bends, you are now keeping your body still. So you're keeping your hands and knees in the same place, but this time you're trying to hitch up your hip to your ribs. So you're trying to bend your lower back side to side. Now what you're not doing here is shifting side to side. You're simply bringing your hip bone to your ribs, and then on the other side, hips to ribs. What this is now doing is adding in a lateral movement, so lateral side bending. So in this same position, we've done the normal cat and cow, which is flexion extension. We've done thread the needle, which is some rotation. And now we've added in some side bends, which is lateral flexion or side bending. And then the fourth thing you can do is simply just put an ice pack on the pain. Now, when it comes to ice, I recommend not doing more than 15 minutes. 10 to 15 minutes is absolutely enough. If you do too much, what happens when you put ice is that you're pushing blood away from the area, which is great, it's what you want. With that, you're also pushing away inflammation, but you need blood to help you repair the problem, repair the damage. So if you put an ice pack on for too long, you're also restricting the blood flow to the area, which means potentially you're also delaying the healing process. So you want an ice pack on for about 10 to 15 minutes, then take it off, leave it off for about half an hour, and then you can repeat. So you can get 2 ice pack sessions in per hour. You can do this as many times throughout the day as you like, but you just want to make sure you're not leaving the ice on for too long. Now, all of this is referenced in my free ebook, which is in the description below. So there's a link to my ebook. All you have to do is click the link and you can get the ebook. It takes you through all of this process, not only going through acute pain, but getting out of chronic pain as well. So if you want to read more into this, then get my free ebook. Hopefully that has helped you guys. Really, really simple process, but you just got to keep moving. Acute pain can last anywhere up to a week to 2 weeks, depending on how bad the problem is. Of course, if it is your lower back, what I would suggest is go and get yourself seen to by someone who can also diagnose the problem. What you want to really make sure is that there's not some kind of disc pathology where a disc may be compressing a nerve, in which case if you do have any numbness or pins and needles going down your legs or shooting pains going down your legs, there's a possibility it could be a disc problem. So always go and get it seen to. Make sure there's nothing pathological going on. Over the Christmas period, a patient of mine emailed me saying he had really bad back pain. Could he come in for an emergency appointment? Unfortunately, I couldn't see him, so we were going backwards and forwards through email. I asked him to tell me what's going on. He thought it was a muscle spasm. Thankfully, he told me in quite a lot of detail what was going on, how the pain felt, what was making things better and worse. And he even sent me a picture, which I'll try and put up on the screen right here. Now, when he showed me where this picture was, the chances are, most of the time these things are musculoskeletal. Sometimes though, these problems can be something else. Now, he had been speaking to his doctor on the phone. He'd been to a walk-in centre, and all he was advised was to take painkillers. They pretty much told him that it was a muscle spasm. And of course, most of the time, these things are muscular, tendinous, musculoskeletal. In this case, something about the character of the pain, to me, didn't seem quite like a muscle. It was constant, it was dull, throbby. It was in the right area for kidney. And anytime he was given massage, gentle massage, or tried moving, stretching, it didn't really help. So I said to him, look, there could be muscle spasm, like the doctors and walk-in people have told you, but it's not worth ruling out that it could be a kidney problem. Now, in this case, it could be kidney stone, it could be a kidney infection. So I said, see how it goes, and if it gets any worse, then go back into hospital, go to accident emergency, and suggest basically what I've told him, that it could be kidney. Anyway, to cut a long story short, he actually ended up calling an ambulance,
got taken to hospital, the ambulance crew actually thought it was a kidney problem as well, and it turned out it was a kidney stone. Obviously since then he's got a lot better, but the point is sometimes these problems are not always musculoskeletal. Now of course most of the time, like someone like myself, I would see musculoskeletal 99% of the time, but it's always worth considering that something else could be going wrong. So you have to be a little bit aware of the presentation of pain. So for example, since we're talking about kidneys, if the pain is in your kind of mid back, often on one side, could be both. So mid back, so just where the bottom of the ribs are. If it's constant, if it's like a dull, throbby, achy pain, then that could indicate kidneys. If you're having problems urinating, that could also be something like a kidney infection. If you're not happy with the advice that someone has given you, say you've been to the hospital and they haven't really examined you or they haven't taken you seriously, then don't be afraid to go and get a second opinion. So don't always settle for the first diagnosis. That doesn't mean that people are always going to be wrong. At the end of the day, as long as you are getting better from the treatment that someone has given you, then that's all that matters. So if you are experiencing pain and it's constant, if it's dull, if it maybe wakes you up at night, or if it just doesn't seem right, go and get it checked out. There's no harm in calling a doctor, going to the hospital, getting some blood work done, having a scan, whatever it is. Go and get it checked out. So that's all I really wanted to just say in this video, is just, you know, sometimes these things are not always musculoskeletal, so don't be afraid to go and get it checked out. I hope this video was useful to you or gave you a little bit of food for thought, or maybe helped you think a bit differently. If it did, or you got any questions, stick them in the comment section below.
In today's video, I'm going to talk to you mainly about low back pain that's chronic and what exercises you can do that might help you to get over it. One thing I've noticed over time, guys, is that people with low back pain are often very tight in the areas surrounding the area of pain. So in terms of lower back, it's often their erector spinae, the muscles going alongside the spine, their gluteal and hip muscles, and also their hamstrings. Now if you look at the diagram, let's assume someone has pain in this region, this lower back region here. Above it you've got the erector spinae, below it you've got the glute minimus, medius and maximus, so the gluteal muscles, the hamstrings, and then lower down into the calf. Those are all really strong muscle groups. I think it's a bit of a chicken and egg thing going on here. Were they experiencing lower back pain because they were predisposed by tight hamstrings, buttocks and hips? Or did the low back pain happen and then, as a way of protecting it, the body then tightened up the hamstrings, the buttocks and the hips? Either way, when you're treating lower back pain, I think it's really important to focus not only on the lower back, but also the areas above and below. So I'm going to show you now a few simple exercises for your hips, buttocks and hamstrings that you can do to start getting more flexible and looser in those areas to hopefully start freeing up your lower back. The first thing that you're going to do is to hang off of a door frame or a bar at the gym. Hanging from a bar or a door frame is safe for pretty much all types of back pain. So this is why I suggest you start with this one first. The reason why you're going to hang is because in your spine, the hanging is going to create a pulling sensation on the intervertebral discs. So if you have a disc bulge or a disc prolapse, then that pulling is going to almost create a suction type mechanism which could potentially pull some of that disc prolapse or disc bulge back in, and thus reducing the extent of the disc prolapse. So reach up, grab a bar, drop your knees down, and just allow your lower back and abdominal region to relax. And from this position, just continue to breathe, but allowing your pelvis to drop. Another really simple but effective stretch and mobilization is what they call in yoga the cat and cow. You're going to start by coming down onto your hands and knees. Place your hands underneath your shoulders and your knees underneath your hips, so you're in an all fours position. Make sure your spine is neutral, so it's neither overly flexed or overly extended. Once you're comfortable in that position, take a deep breath in, and as you breathe in, look up towards the ceiling and push your belly down so that your lower back is bending. Once you've taken another deep breath in, breathe out, and as you breathe out, drop your head down. Lift your lower spine as much as you can, almost like someone's got a piece of string on your back and is lifting it up. Once you've fully exhaled, take another deep breath in, and as you do that, lift your head up again, pushing your belly down. The reason I think this is a good exercise to do is because it causes movement throughout the lower back, which makes the muscles of your lower back, the erector spinae, contract and relax, which helps to push blood through the muscles and allows better drainage of the blood, and any inflammation helps to push it away. I suggest doing this about 5 to 10 times really slowly and just focusing on the speed of your breath rather than trying to get through the movement. The next really important stretch is for your hips and buttocks. You can do this while you're at the office or at home or anywhere that's seated. You can also do another variation, which is lying down on the floor, which I'll show you afterwards. So if you're at work and you're sat down on a chair, perch to the edge of your chair, put one leg on top of the other knee, hold your shin with both hands, and then use your elbow to push that knee down. If you want to increase that stretch, you can lean forwards into it. But most people will find that this is enough just by putting a hand or an elbow on that top knee and pushing down. One thing I would just point out to you guys is don't put your foot on your knee, because that's going to put a lot of stress through your ankle, which will make your ankle ligaments start to become overstretched. So make sure that ankle is well over your planted knee. From here, grab your knee, lift your knee up and over, so that now you should be feeling a stretch through your buttocks. When I do these stretches on myself, I like to do each stretch for about 20 seconds, alternate into the other one, about 20 seconds, alternate back, and keep repeating every other 20 seconds. I find that this helps to keep it a bit looser, almost like it's pumping blood through the area, and almost a bit like exercising it rather than just purely stretching it. If you're a bit more nimble, or you're at the gym or you're at home, I find this one actually is a lot stronger. Cross your legs, then with it, whichever one you want, put on top of your bottom leg, and then either using your hand or your elbow, push that knee down and hold. After about 20 seconds, grab your knee and pull your knee up and over the other way. Now, some people find that this stretch is too hard to get into, so one way of working around it is to put one leg straight, cross your other leg over, and then do the same thing. When it comes to stretching your hamstrings, quite often you'll see runners in particular doing it wrong. And what people tend to do is have their legs straight and then flexion through their spine. So they're trying to bend their whole bodies, which puts a lot of strain through the nerves at the back of the legs, but also puts a lot of strain through the lower back as well. So in my opinion, the best way of stretching your hamstrings is to have a soft bend in the knees. Now, if you're really tight to begin with, Then have one leg bent. From here, bend the other leg, keep your chest up and your back straight. Now when you come to bend forwards, you're going to try and push your belly forward onto your thigh, like this. I hope that today's video has helped you at least get a little bit more of an understanding of what you can do for your lower back. What I would suggest is the more you put into it, the more consistently you do your exercises, the better results you're going to get from it. If you're only doing these exercises once a week or less, you're not really going to see any changes at all. My suggestion would be that you did these exercises maybe every other day at least, but preferably every day. You don't have to do these exercises for 10, 15, 20 minutes a day. You could perhaps just choose one exercise and do that stretch for 1 to 2 minutes, and then the following day you could do one of the other stretches and do that for 1 or 2 minutes, and so on. And that way you're going to consistently get something going on every day, which will eventually lead to your lower back starting to respond and hopefully loosening up and becoming more and more pain-free as you go. But of course, I would suggest that if you do have persistent low back pain, go and get it checked out by someone who knows what they're doing, someone who knows what to look out for, and who can advise you much better than a Google search. I see lower back pain all the time. Now, when I see people with low back pain, they always obviously have very tight backs. But one of the other things they often have is very tight hips. So I'm going to show you how to stretch your hips in a couple of different ways. The first is in a seated position. If you work in an office or you're out and about and you don't really want to be on the floor, this is a great way to do it. So start on the edge of a chair as far forward as you can. Put one leg on top of the other leg. I like to hold onto my shins just to keep it in place, and then with my elbow I'll push that knee down as far as I can. You should be feeling that in your hip just on the side here. If you don't, push that knee further down, lift your chest up and lean forward from your stomach. So from here, lean forward as far as you can and hold. So I like to do that for about 10 to 15 seconds. From there, what I will often do is then take my knee up and over towards the opposite shoulder. And so I'll pull that across as far as I can. And now I should be feeling that through the buttocks. Again, I'll hold that for 15 to 20 seconds and then go back into the other stretch for the hip. All right, so this is the same stretch as the one we have just done. I'm going to show you two versions now. One if you are super inflexible and one if you are slightly more flexible. So the first one is to have your leg out straight. Bring this, the hip that you want to stretch, bring this leg across and put your ankle on top of your thigh. Again, hold onto your shins and push your knee down. Now, if you're quite inflexible and you find it hard to lean forwards, take one hand behind you and push this knee down. You can either do it the same side or you can change your arms around and push down away this way. One thing to note about all of these stretches is when you're setting yourself up, make sure your ankle is fully over that thigh, so you're not bending at the ankle, so your foot isn't resting on your thigh, because that will stretch your ligaments too much, so it could give you some ankle problems. Now, once you've done this one, of course you can do the same thing, bring that knee up and over to the other side. But the one I like to do is to have my leg bent underneath, and then the one I want to stretch, I'll bring up on top and go from here. So I'm going to hold onto my shin, and with my elbow I'm going to push down. To make it more intense, lift your chest and push your belly forwards. If again you're finding it difficult to sit in this position, you can put one hand behind you and use a straight arm to push that knee down. So again, about 15 to 20 seconds, hold in one position and then up and over. So we're stretching now through the buttock. Hold that for 15 to 20 seconds and repeat. Now, following on from this, these are stretching the muscles quite nicely. but we can also get into the hip joint itself. I call this the 90-90 stretch, and some people call it the hurdle stretch. So what you're going to do is to sit yourself like so. So one knee, the back knee is at 90 degrees here. The hips are at 90 degrees to each other, and the front knee is at 90 degrees. From here, you're going to try and get your back bum cheek down towards the floor, and you're trying to push that down as much as you can. It's quite uncomfortable. It's quite painful, but if you've got tight hips, this is something you really need to do. So you're pushing that hip down towards the floor, and I'm going to hold this for about a minute. From there, what I tell people to do is then to take this knee, this back knee, up and out as far as they can and back down. And I get them to do this about 10 times. So up and out. And as you're doing this, what you're trying to do is to take that joint through a really painful range. The more painful it is, the more that means you're working into the tendons, the ligaments, and the joint capsule itself. So it's kind of breaking down all that tightness, all those adhesions in that hip joint. Once you've done 10 of these, then flip over onto the other side. Set yourself up in the same way. So your knee is at 90 degrees, front knee is at 90 degrees, and your hips are at 90 degrees. Push that back bum cheek down, and then after about a minute, up and down 10 times on that side as well. So the more you do these stretches, obviously the more flexible your hips are going to become, the less strain it's going to put on your lower back. So if you have low back pain, I would suggest doing this stretch at least every other day. And obviously the more you do it, the looser everything is going to become, and hopefully the less pain you're going to be in. Today I'm going to tell you the 5 key processes that you need to follow to get yourself out of low back pain and stay out of low back pain. So the 5 processes are: number 1, get yourself effective treatment. Number 2, get yourself more flexible. Increase your joint range, increase your flexibility, stretch the areas that are affected. Number 3 is to strengthen the areas of the pain and around the pain. Number 4 is to improve your sleep. And number 5 is to improve your nutrition. So I'm going to tell you now more detail about every process. The first process is to get yourself an effective treatment. I see patients all the time who are in pain, particularly low back pain. The way I see it as an osteopath is that we need to get them out of pain first before we can do anything else. So the way I think about getting people out of pain is to improve their blood flow through the joint and through the muscles. Anytime there's pain, there's always going to be tightness, because what the body is doing is locking itself down, trying to protect the area that is affected. So what we need to do is to get that blood going through those tight parts of the body. When a muscle is tight, it doesn't allow blood flow through as effectively as it would if the muscle was completely relaxed. What this inevitably means is that the joints and the areas around what is in pain are going to be more reduced in terms of their movement. So as an osteopath, my aim is to increase the blood flow and restore joint movement through every area around or in that area of pain. So once you're out of pain, or once your pain is reduced, the next step is to improve the mobility through your back and through your hips, because in my experience, the hips are often extremely tight, hips and hamstrings, and I believe that often leads to the onset of lower back pain. So we're going to start with cat and cow. We're going to do hips and buttocks and hamstrings. I've done a video on some of these already, so I'm not going to go into too much detail. But what we're doing here is we're stretching the lower back, or we're mobilizing the lower back. So as you can see now, I'm doing the cat and cow. And what I'm doing is I'm rolling my pelvis forwards and backwards and lifting and lowering my spine with the aim of trying to increase flexion and extension through my lower back, just to get movement going through it. The reason why I like this stretch is because it's non-weight bearing and it doesn't have particularly much strain through the lumbar discs or through the facets or even the tendons. So low stress on the body, and it's just a nice way of getting movement through the lower back without putting too much strain on it. The next one is a hamstring stretch. Most of the people I see in clinic for lower back pain are extremely tight in their hamstrings. Now, if your hamstrings are extremely tight, that's going to be putting more strain on your lower back because you can't flex forwards, or you can't reach the floor, or you can't move in a nice, easy, balanced way. So what's happening is, because your hips can't bend, because your hips can't flex, your lower back is having to put much more strain or put much more effort into getting that same range of motion that you could if your hamstrings are more flexible. Now the last two are for your hip. This is one of my favorites if you've got lower back pain, because I guarantee that your hips are also very tight. So sitting on a chair, put your shin on top of your knee, hold on to your shin with your hands, and push your knee down with your elbow. And what you should be feeling is a stretch through the side of the hips. So stretch that by pushing down on the knee. Once you've done that, lift the knee up and over to stretch through the buttocks. So they are the key stretches that I would do for lower back pain. Now the next phase, once you've improved your flexibility, and that phase can take weeks, if not months. So the more you do it, the more consistently you do it, the better the outcome is going to be. But once you've done that and you feel like your joint range has improved or your muscles are more flexible, then we're going to go on to the next process, which is to strengthen. The next step is to strengthen those areas. So strengthen your lower back, strengthen your hamstrings, your hips, and your gluteals. Now I'm going to start off very basic, and these exercises can be done at home. And then I'm going to progress into exercises that can be done in the gym. Now, in my opinion, the ones in the gym will be more effective, but if you haven't got a gym membership, then it doesn't matter, because the ones at home will do just fine.
Lie on the floor facing down and place your arms by your sides. Lift your chest while keeping your neck neutral. Pause at the top and then lower back down with control. To progress this exercise, place your fingers by the sides of your head. Then, to progress this again, you can straighten your arms above your head. Position yourself on a back extension and make sure the pad is just below your waist. Place your hands on your lower back, one above the other, and as you start to go down, you should notice that your hands naturally come apart. This is a good indication that you're bending from your lower back and not from your hips. When you get to the bottom, pause, and as you start to come back up, lift with your chest first. Pause at the top, and again lower with control. To work your hips at home, lie down on your side and bend your knees behind you. Keeping your feet together, lift your top knee as far out as it will go. Pause at the top and lower down with control. To progress this exercise, as you lift your top knee, you can also lift your top foot too. Once you're familiar with this exercise, you can then straighten your top leg to make your lever even longer. To work both hips simultaneously, as you go to lift your top knee, also push your bottom knee out so that it lifts your hips off of the floor. To make this progression harder, you can then straighten your top leg. And the last and hardest progression is to have both legs straight and lifting the hips and the legs at the same time. On the abductor machine at the gym, push your knees out as far as you can, pause and return your knees back to the middle nice and slow. Throughout the exercise, make sure the rest of your body doesn't move to ensure that the only muscles working are your hip muscles.
To work your hamstrings at home, find a step and lie down in front of it. Place your feet on top of the step and make sure you're close enough to the step so that your knees and your hips are bent. Your knees should be up in the air. When you're ready, push your heels into the step to lift your hips. Keep your abdominals pulled in towards your spine and make sure you're not using your lower back muscles to help you lift. You should be feeling this in the backs of your legs and in your buttocks. To progress this exercise, lift one foot off of the step and pull your knee in towards your chest, and just repeat as you did with 2 legs. To work your gluteals and hamstrings at the gym, lower the back extension pads so that they're around about the top of your thighs. This time, as you bend forwards, bend from the hips and not from the lower back. As you come back up, push your hips into the pads and squeeze your glutes. There should be minimal movement from your lower back and all of the movement through your hips. You should be feeling this in your buttocks and your hamstrings. For a prone hamstring curl, lie on the bench and press your hips as firmly into the bench as you can. As you curl up, make sure you're not using your lower back to help you curl the weight. Once you get to the top, pause and lower the weight back down slowly. The seated hamstring curl is much the same as with the prone hamstring curl. Set yourself up in the seat and ensure you're locked in nice and tight. Pull down only using your hamstrings. Pause at the end and lower back up slowly. Avoid the temptation to use your body or your arms to assist in pulling the weight down. Okay, so the last 2 processes are actually, think of them as bonus processes. If you can try and do these will actually really help. The 4th process is to actually go to bed earlier. Now I say this because most people I see tend to go to bed around 11, 12, half 12, somewhere like that, and usually getting up early in the morning because they have to go to work. Now sleep is very important because as we go through the night, our hormone levels change. As our hormones change, it puts our bodies in phases that are more suitable for physical repair and more suitable for mental, emotional, sort of cognitive repair. Now, in theory, between 10 p.m. and 2 a.m. is when our bodies are best suited for physical repair. Now, if you're going to bed at half 11, 12 o'clock, you're missing out on an hour and a half to 2 hours of physical repair. So if you can gradually get yourself to bed a little bit earlier every week, then that will really help. And I think you'll feel better for that in the morning. So aim to get into bed or lights off around about 10 o'clock. The last process is to have good nutrition. Now they say you are what you eat, and that is very, very true. I could go into a little bit more detail about you are what you digest and you are what you absorb, but that's for another day. But essentially, the better quality food that you can eat, the more nutritious they're going to be, and the more nutrients that are going to go into your blood. The more nutrients that are in your blood means that those nutrients can go and supply areas of tissue damage or areas that are undergoing repair. If you have poor quality nutrients in your blood, it's going to take a lot longer for you to heal. Now, in my experience, when I went through a period of real uncomfortable lower back pain, I cleaned up my diet. It took a couple of weeks, but after really taking out all the rubbish, all of the sugar, all the processed foods, I noticed that my back pain had gone from 90% of the time down to about 10% of the time. And it was the first time I really noticed such a difference in how nutrition can affect pain. So eat better food if you can and when you can, and it will just add that little bit of extra support for your body to help you repair. So that's the 5 processes, guys. Process number 1 is to get yourself out of pain. Have a good treatment. Find someone like myself as an osteopath. If you're in London, you're always welcome to come and see me, or get yourself a sports massage. Process number 2 was to stretch the affected areas and the areas surrounding your pain. Process number 3 was to strengthen or to rehabilitate yourself. So strengthen the area that was affecting you and strengthen the areas around it. Process number 4 was better sleep, and process number 5 was better nutrition. If you have chronic low back pain, then I'm about to show you what I think is one of the best exercises you can do to overcome your chronic low back pain. Now, this exercise is called a single leg Romanian deadlift. You can do this at home, you can do this at the gym, you can do it anywhere because it doesn't need much equipment. I'm going to show you exactly how to do it, and we're going to go from the easiest variation to the more complicated variation. So there's something in there for every ability. This is great if your injury, if your lower back problem is a muscular problem. So if you have a disc issue, then please make sure you get it checked. Make sure you've been given the all clear to do exercise before you try this. But most of the time, people I see have chronic low back pain, which is muscular. So let me briefly explain why I think this is one of the best exercises for people with chronic low back pain. And I'm going to keep this really brief, so I'm not going to go into too much detail. Now, essentially, people with lower back pain, especially chronic low back pain, tend to be quite weak in their lower back muscles, their glutes and the hamstrings. This exercise will work all 3 of those muscle groups. So it will strengthen your hamstrings, it will strengthen your glutes, and it will strengthen your lumbar erector spinae. As you get stronger in these muscles, they're going to become more functional, they're going to become stronger, and they're going to help to protect you in the future. So not only are they going to help you overcome chronic back pain, but they're going to prevent back pain from coming back. As long as you can keep these strong, then you're less likely to have back pain again in the future. So there's 3 variations you're going to go through. I would suggest starting with the simplest version first. So what you're going to do is find yourself a step with one, so you stand quite close to the step, and then with one foot, just step back. Keep this foot on the floor for now. Then with a soft bend through the knee, you're going to lean forward, keeping your back straight, touch the step in front of you, pause, and then come up with control. As you come down, make sure you're not falling down. So you're coming down with control, pause, and then come back up. As this exercise gets easier, then you can take this foot, so the back foot, this will come off the floor, and then you keep that leg straight behind you, again with a soft knee, and then come up. So think of yourself like a seesaw. So your leg and your body are all one line, one straight line. So this leg comes back and your body comes down. As you start to come back up, don't drop your leg first because that will put a lot of strain through your back. So as you come back up, drop your leg down as you lift from the chest and then repeat. So from the front, take one foot back, lean forwards, touch the step, and come back up. Again, come down, touch the step, keeping your back straight, and come back up. And the next variation from there is to take your foot off the floor, take this leg far back as you can, come down, touch the floor, or touch the step, and then come back up. As you come down, what you want to try and also make sure is that your hip is kind of level. So you don't want to be lifting, you don't want to be rotating through your body or through your hips. You want to make sure that your hips are level to the ground as much as you can. Sometimes the only way you can really see this is if you film yourself doing it or get someone to tell you what you're doing. So as you come down, try and keep your hips level to the ground as much as you can, and then come back up. Once you've done that for a while, and you find that relatively easy, what you can then do is start adding some weight. So I would use 2 dumbbells, and from here, same thing, but just without the step. Come down, pause, and then all the way back up. Now, if this is the first time you've done this exercise, then it can be quite difficult. A lot of my patients can sometimes go into cramp. So what I would suggest, if this is the first time you're doing this exercise, then start off with only maybe 5 repetitions on each side. Start with the easiest variation first. Now this may be too easy, in which case then go up to 10, that's fine. Aim for a maximum of 10 repetitions. As you have done this once and you've done this a few times throughout the week, then the next time you come to do it in the next week, then add in a second set. So you're still on the easiest variation first, because you don't want to overdo it. You don't want to overload your lower back. If you do too much, then potentially you could risk having a recurrence of your lower back pain. So start with the easiest variation, start with 10 repetitions or up to 10 repetitions. The next week, then you go into two sets, and you do that maybe 3 times throughout the week. Then once you've done that, then you can go into 3 sets, still with the easiest variation first. Once you've done that and you've got familiar with that, you've got comfortable, you can do that, you can complete the 3 sets of 10, then you can go into the next progression, which is the single leg. So the one with the leg up in the air. So you can do 10 repetitions of that, only 1 set. Then the next time you come to do it, if you found it quite easy, then you can do the second set and then of course build up to the 3rd set. So what you're doing here is gradually increasing the difficulty of the exercise. You're not overloading, you're not doing too many sets in one go. So as you get more familiar with this exercise and you can complete 10 repetitions, then you can add in another set, building it gradually up to a maximum of 3 sets of 10. Now, once you can do 3 sets of 10, then the next progression is to go into the one with the weights. So again, you're still doing 3 sets of 10, but what you can do here to make it more and more progressively difficult is to add in additional weight. So if you are adding weight, then maybe start with just 2 or 3 kilograms. So we're looking at about 5 to 6 pounds in each hand to start with. Now that might sound like quite a lot, but if you've been gradually building up, then you should have been getting stronger and stronger. So if this exercise is causing you pain, then just stop. Give it a day or two's rest and then try again. If it's still causing pain, then just give it a little bit longer. Of course, you have to make sure you are in phase 3. If you don't know what I'm talking about, then I suggest getting my ebook, my free ebook, which is in the link in the description below. So in the ebook, I cover 3 phases of recovery. So the first phase is just getting the pain down. Second phase is improving your flexibility and mobility. And then the 3rd phase is about the strengthening. So you have to make sure you're ready for phase 3. Hopefully today's video has helped you. If it has, please let me know in the comments section below. Give this video a thumbs up if it has helped you. And I would love to know what you find is the most beneficial exercise for your chronic low back pain, or what exercises or what other therapies you have found to give you the most relief from your lower back pain. Do you know, one of the most common causes of lower back pain that I see is gardening. Now you wouldn't really think it, given that most of the time gardening is fairly slow. There's a bit of cutting, maybe some mowing. It's not like you're lifting heavy weights in a gym. It's not like you've been involved in a car crash or something traumatic. It's low impact, it's easy going. But the problem is, gardening actually is very repetitive. And in gardening, there's a lot of bending. So, I mean, it depends on where you're at. Now, if you are just sort of bending forwards, doing some potting, just pruning some shrubs or flowers or whatever it is that pruning does, there's not much involved in it. But because you are in a bent over position for a long period of time, that's where the issue comes. Now, of course, you could expect back pain if you're doing a lot of shoveling, digging, lifting of turf, trees, logs, that kind of stuff. So heavier things, you would expect some back pain. But where gardening takes a long time, it's very repetitive. I found myself explaining it like this. Imagine the muscles or tendons in your back like a rope. Now there's 2 ways that you can damage a rope. You can either put so much force through it that it snaps, or you can gradually wear it down, fray it over time, so very low impact activity, but over time certain fibers get worn down and it just gets weaker and weaker and weaker over time. So think about this like your lower back muscles and tendons. you can either damage your back doing something like heavy lifting. So you can go out, shovel some dirt, and one movement may just be too heavy as you twist and bang, your muscles go into spasm. Or you could just be potting for hours and hours and hours and pruning and just bending forwards. And while at the time it seems fine, by the end of the day, you find yourself getting pain and your back locks up. And this is very common. I see this a lot in a lot of my patients. They've been outside, they've done gardening for hours, they've come back in, sat down, and then as they get up to move, the back has just gone into spasm. So if you are going to be doing gardening anytime soon, my advice to you is, first of all, keep changing positions. Be aware of the position that you are in. So if you are sitting on a stool and you're bending over for a long period of time, maybe every 10 minutes, get up, walk around, stretch the opposite direction. So if you've been bending forwards, then try bending backwards. If you're doing slightly more heavy duty work, mowing, digging, lifting, then periodically take breaks. Just take a break, walk around, grab a drink, and just pay attention to how your back might be feeling. If it's feeling tight and you are generally unconditioned, so let's say you're not a gym goer, the only exercise you're doing is gardening, then you're very likely to overdo it with your back. So unless you've got a strong back already, unless it's something that you do on a day-to-day basis, just be careful of overdoing it in one go. If you do find yourself later on in the day tightening up, going into spasm, the best thing you can do is, first of all, ice it for about 10 minutes, just reduce some of the inflammation. Try and keep yourself moving gently, just try and ease those muscles out. If you can handle it and you can take it, if it doesn't interact with anything or your body can handle, you're not allergic to it, then take some anti-inflammatories. And let's just hope that the next day you're not in too bad a way. If you are in a really bad way the next day, try and keep moving, take some more anti-inflammatories, go and see someone, get a diagnosis, get some treatment. But basically the message of today's video is, if you're going to start gardening, be aware of how much you're doing, how much load you're putting through, what positions you're in and how long you're in those positions. A question I get asked quite a lot is, should I try swimming for my lower back pain? Now, it's not as simple as yes or no. In this video, I'm going to try and explain what my thought process is regarding swimming and whether it could be appropriate for you. So the first thing you need to figure out is kind of where you are in terms of your pain. Now, if you've ever seen or listened to any of my previous videos, you would have heard me talk about the 3 phases of pain. Phase 1 is all about just getting pain down. Phase 2 is about restoring the flexibility and mobility, and phase 3 is about restoring strength. If you want to learn more about this, you can get more information in my free ebook, which is in the link in the description box below. But if you've got back pain, first of all, let's think about what phase you're in. Now, if you are in acute pain, if there's a lot of pain, you can barely move, there's a lot of spasm, then what you can do in the pool is going to be completely different to if you're in phase 3 and trying to strengthen your back. So if you are, let's say, in phase 1, so you are in acute pain and you want to just try and get the inflammation and the pain down. If you want to go into a pool, I would definitely say you need to avoid swimming. But that doesn't mean that you can't move. And actually, being in the water may help to take some of the weight off your back, your muscles, your joints, your discs. So it can reduce some of the weight of your body. And then if you just gently move around, so just float in the water, a little bit of side to side, a little bit of shimming your hips up and down, and even just walking up and down the pool may just help to loosen up some of the muscles. And as you move through the water kind of almost gently massages your skin and your muscles. So it helps to reduce some of the inflammation in the area. But if you are in acute pain and you are going to do this, don't do it for much longer than 10 to 15 minutes because everything is very sensitive right now. So there's a good chance that you could flare it up, and once you get out of the pool, it could be even worse.
Now, moving further along, let's say you are past the point where it's acute. So the pain has come down, you say maybe at a 5 or a 4 out of 10. This is where it starts to get a bit more complicated. If you are going to try swimming, there's a good chance that your back muscles are in some form of spasm. And this is why phase 2 is important, because it helps to stretch and release some of these tense muscles. But if the muscles are in a state of spasm, there is a possibility that swimming or any activity could make the spasm worse. So the first question I ask most of the patients that ask me the question is, are you a good swimmer? And this is important because if you are not a good swimmer, let's say you're doing either breaststroke or front crawl. Breaststroke, you are in a forward plane, but as you try and breathe, you lift your head out of the water and you arch your back. So your lower back goes into a lot of extension. This involves contraction of your lower back muscles. And if they're already contracted or already spasmed, this could put it into more spasm. Likewise for front crawl or freestyle, if you are a bad swimmer and you haven't got the breathing, so when you breathe, you should be rotating to the side. What I see a lot of people do is, because they're afraid of swallowing water, they tend to lift their heads up. So they might turn a bit, but then they look up to try and breathe, and then they come over. This is the same principle. If you are going to do that and you're not a good swimmer and you're breathing by lifting your head up, again, you're likely to put your lower back muscles into more spasm. So theoretically, swimming is going to be good for you, but you have to make sure you can breathe. So when you are breathing, if you're doing freestyle, if you're doing front crawl, the key is to rotate the hips and the shoulders at the same time as you come up to breathe. If you're going to lift by lifting your chest and your head, then that's not so good. Same with breaststroke. I would tend to try and avoid breaststroke if you've got lower back pain, purely for the fact that you are lifting your chest, you are lifting using your lower back muscles. If you are further down the line and there's no pain, the spasm has gone, so we're in phase 3 now and trying to strengthen, it's less of an issue. So you're less likely for those muscles to go into spasm, but swimming may not be my first choice for this. So I would tend to advise most of my patients go into the gym and try and strengthen the muscles, and then maybe supplement with a bit of swimming. So generally swimming is great. I do love swimming. You just have to be very careful with what phase you are in. So go and get my ebook to figure out what phase you're in and what you need to be doing about it. Once you feel like you're in the right phase, then swimming is useful, but just be careful. Make sure you're a good swimmer. Make sure you can breathe well, rotate through the body if you're doing freestyle. Inevitably, someone might ask me about backstroke. Backstroke theoretically should be fine. I just don't like backstroke. As an ex-swimmer, I just never used to like backstroke. Partly because you can't see where you're going. But in theory, it's going to put less pressure in your lower back. So potentially that one actually could be okay for you. Just be careful if you're going to be looking behind you, just be careful of arching your back and twisting, things like that. So if you want to give swimming a try, just make sure you're in the right phase, sort of phase 2, phase 3. Make sure you're not going to be going into spasm. And if you are new to swimming or you haven't swum in a while, your fitness may not be so great. So you could potentially overwork your muscles. So maybe 10 to 15 minutes at the most for the first session or two, and then gradually build it up as you get fitter.